Let's react to Billberg's video on preventing balding.
In 2019, I started losing my hair myself, and I have never ever felt so insecure about myself. It got to a point where I would talk to this girl and she would talk to me back.
He's talking to cartoon characters?
And the only thing that I could think about was, is she currently just looking at my hairline? Is she currently watching my scalp? And it made me feel like
yeah, from what we're seeing here, it looks like he has Norwood 3 recession on that right side. Yeah, I mean, that's understandable because a lot of people feel self-conscious about their hair loss. And that's one way that it manifests. When someone is looking for a significant other, they might feel that they're less desirable because of the hair loss that they're experiencing. So it's definitely a vulnerable place to be in for him to share that with everyone. But I think it's very commendable that he's willing to do that.
And that's the reason why I'm doing this video today, because you can fix your hair. You do not have to go bald. You do not have to ever face that feeling of insecurity that I felt myself. So first you need to understand why you are losing your hair.
He's right, there's almost always some option for not going bald, especially if it's caught early. So knowing your options is super important, and that's why we make these videos, so that people know what their options are, and even if they decide to go bald, that's fine, but at least they know what other options there might be.
There could be many different reasons why you are losing your hair. First is because you're deficient in minerals and vitamins. And the minerals and vitamins that you can be deficient that makes a big difference is if you are deficient in zinc, vitamin D, vitamin C, and biotin. Those are super important.
And keep in mind, most of us get enough of those vitamins from our diet. And most people are not deficient in these vitamins. So this isn't the most common reason to lose hair, but it might be one of the reasons why someone might be losing their hair. And if their levels of these different vitamins are very low, yeah, sure, it's possible that it might be contributing, but this isn't the most common reason. The most common reason is typically hormonal, meaning that androgens are at play in the continued miniaturization of our hair. In the most common form of hair loss, which is androgenic alopecia, and that's the same for men and for women.
However, if you are like myself, and you have done your blood work and you know for a fact that you're not deficient in anything and you are hydrating, you're sleeping properly.
He mentioned blood work here, and I wanted to comment because some people come to us expecting us to get like full panels of blood work on every single patient who's experiencing hair loss. And most of the time, that's not standard of care and that's not required for making a diagnosis. The reason why it's called male pattern and female pattern hair loss is because there are these basic patterns that we see clinically when it comes to androgenetic alopecia. By recognizing those patterns, which go way beyond the typical Norwood or Ludwig scales, there is the ability to make a clinical diagnosis and then properly treat the patient. Extensive blood work is typically not recommended for just everybody because oftentimes you get blood work back and it's normal, or you get some abnormalities, but you don't exactly know what to do with that information. Sometimes it's, yeah, take some vitamin D, but other times it's more difficult to figure out, what exactly do you do with that information? And that even goes for checking things like testosterone and DHT levels, because people with low levels of testosterone and low levels of DHT can still see very aggressive miniaturization of their hair and thinning of their hair because of how sensitive those DHT receptors are in their hair follicles to those hormones. So it's not just the levels of hormones that are circulating in your blood, it's also the sensitivity of your receptors to those hormones. And oftentimes that's forgotten, and oftentimes people just say, oh, why isn't he checking my blood work? Online they'll check my blood work if I go to, X, Y, and Z lab. Yes, but what are we going to do with that information? And to have just numbers on a piece of paper without knowing how to use those numbers properly, not because I don't know what to do with them myself, but because in the collective medical literature, we don't exactly know what to do with some of these numbers. So getting information that we're not going to do much with is sometimes not the best move.
And you are hydrating, you're sleeping properly, and not suffering from high levels of stress, then what you could be suffering from as well is male pattern baldness.
Again, I would jump to male pattern baldness before considering all those vitamins that he had mentioned, because we know that male pattern baldness is going to be the primary explainer in the majority of cases of why especially men lose their hair.
Very easy to know if you're suffering from male pattern baldness, because the only thing that you do is that you have a look at your genes. You have a look at your dad, you also have a look at your grandfather on your mom's side, and then you will know what hairline you will receive.
So it's not that easy. We used to think that it was as easy as that. Just take a look at your family and see what the different hairlines are and the different forms of hair loss, and you're likely going to get one of those. But now that we know that there are many different types of alleles responsible for male pattern loss, not just on the sex chromosomes, but also on autosomes. So it's not as easy as looking at our father or our mother's father and being like, yeah, that's exactly the kind of hair that I'm going to have.
So male pattern baldness is because you are sensitive to a hormone called dihydrotestosterone, or DHT. Now there's many ways to block DHT, and in my personal experience you can block it the natural route, or you can block it the unnatural route.
Well, people have different perspectives on this. Essentially, you're going to be blocking the enzyme that's converting testosterone to dihydrotestosterone, and that specific enzyme, 5-alpha reductase, can be inhibited with certain natural supplements and certain medications, of course. So he does have a point here, but essentially it's blocking that same enzyme.
And blocking it the unnatural route will give you the most amount of hair back, or prevent hair loss the most.
Not so much getting your hair back with a 5-alpha reductase blocking, but more so preventing further loss. That's the most common type of clinical manifestation that we see when we block 5-alpha reductase.
However, blocking it the natural route is going to give you the least amount of side effects. So there are side effects to any medication that you take.
It's going to give you fewer side effects because it's less potent. And the same goes with the unnatural route that he was talking about, such as with finasteride. If you go to low doses or less frequent use of finasteride, or to say the topical finasteride, which by the way we have at feelconfident.com, you're going to have less efficacy, but you're also going to have fewer side effects. And it's like that with the more natural supplements that I'm sure he's going to talk about, such as saw palmetto, pumpkin seed oil. We know that those also have DHT blocking potential, but they're going to be less potent. So they don't work as well, but sure, because of that, they're going to give you fewer side effects. But that doesn't mean that you won't get any side effect on the more natural 5-alpha reductase blockers. You could still get side effects. It depends how sensitive your system is to these various blockers.
I have had side effects myself. What I found is that I tried the unnatural route, which I should not have done. So first, always try the natural route.
Yeah, I don't agree with that clinically, because some people are on all of these weak blockers for many years, and during that time they continue to lose their hair, but they feel like, hey, I'm doing something. I'm putting an oil in my hair. I'm using some kind of, saw palmetto pill. Like, surely I'm doing something. I'm using a shampoo. I'm using the Feel Confident shampoo, right? Like, people feel like they're doing something, but sometimes they're not doing enough. So it's fine to do these natural things, but for some people who have more aggressive or more pronounced hair loss from the androgens, they need to usually do more to prevent that loss. And typically that means going the unnatural route and getting on something like finasteride.
There are 3 products that you can utilize. One of them are natural and seems to work really, really well, and that is saw palmetto. Now, saw palmetto,
and that's one of the actives in my shampoo, conditioner, and thickening foam for the reasons he's about to explain.
You take it at 320 milligrams, and the only thing that you need to know is blocks DHT. According to a lot of studies, according to myself as well, I got a lot of hair back on my head as soon as I started implementing saw palmetto.
Yeah, you can use saw palmetto within, like, say, a shampoo like ours, but you can also take a pill and use it as an actual, like, vitamin, right? So both are essentially options.
However, you need to take saw palmetto on a full stomach, because if you do not take it, you can get some nasty side effects when it comes to gut, and you can get a lot of pain through the stomach, which I experienced myself, having to sit on the toilet for freaking 4 hours.
That's a good point.
Number 2 is going to be utilizing finasteride. I have utilized finasteride myself, and I found that even though I didn't get any of the super nasty side effects like erectile dysfunction, I did get a decrease in mood and motivation.
That's not a common side effect. The most common is going to be the sexual side effects like decreased libido and also potentially erectile dysfunction. Less commonly would be something like feeling like your mood is altered and that you maybe don't have as much energy or feel more depressed. Most people who have those symptoms have some predisposition to those symptoms in the first place.
I do not like finasteride so much. However, I still take it. And what I do is I actually only take 0.25 milligrams utilizing a tablet cutter. And that is a great way for you to get finasteride, block DHT, but don't get the nasty side effects that you can get.
Yeah, what we recommend is starting with the classic 1 milligram dose a day and then bringing that dose down depending on how you react to the 1 milligram daily. If you have side effects, then come off of it, wait for those symptoms to resolve, and then restart at a lower dose. We'll usually recommend dose reducing to 0.5 milligrams as a next step after, like, let's say the 1 milligram did not agree with your system. And some people even do the 0.5 milligrams every 2 days or every 3 days. And that seems to work for the majority of people to still prevent hair loss, but also minimize side effects.
I did try the finasteride as well in the freaking full dose, and I have never felt so bad. So I don't recommend anyone to ever take the finasteride. It's the strongest of them all, and I do not recommend it whatsoever.
Yeah, so again, maybe it didn't agree with his system because it sounds like he had side effects even on 1 milligram of finasteride. So going up to the more potent cousin, which is dutasteride, really made no sense, right? So if anything, he needed to dose reduce, and that's why he found the 0.25 milligrams of finasteride to be effective and still safe for him from a side effect profile. Going up to dutasteride after you had side effects from 1 milligram of finasteride is not a good idea. And that's actually why I don't include dutasteride on the Feel Confident website, at least not for now, because I don't want to confuse people. Because the problem is with these direct-to-consumer websites, like some of the competitors as well, is that usually the information that's given to patients is more minimal, and even if a doctor, virtually approves the prescription, there typically isn't as much thought and attention that goes into picking the proper dose for a patient compared to when you actually reach out to, say, a clinic like mine as a patient and have a full conversation with myself or with my PA about what might make the most sense for you, for your hair, from a medical therapy perspective, and of course sometimes from a surgical perspective. But of course when you're just shopping online, I'm always afraid of confusing people, and then people will click potentially on dutasteride and get on the stronger version and have more side effects. So I never start people on dutasteride, but sometimes when people don't respond well to 1 milligram of finasteride, and I mean from a hair prevention perspective, but have no side effects, then for those patients we consider either increasing the dose of finasteride or going to dutasteride at, say, 0.5 milligrams daily so that they have something a little stronger in their system to help block that DHT further. And for most of those patients, they continue to not experience side effects if they've done well on 1 milligram of finasteride for many years. So there's lots of clinical caveats.
What I personally do is I take saw palmetto every single day. Actually works as a testosterone booster as well, so that's pretty freaking amazing.
Well, what people don't understand, with these 5-alpha reductase blockers, you're actually increasing your testosterone. So including with finasteride, you're not decreasing testosterone, you're increasing testosterone because you're blocking that conversion to DHT. As you block the conversion, the testosterone, is actually going up, not going down. And oftentimes because there's a lot of misconceptions about that. So the same thing with saw palmetto. You're blocking that 5-alpha reductase converting enzyme, so you're actually driving your testosterone up. So that, again, is something that a lot of people can't wrap their minds around.
0.25 milligrams of finasteride 4 times a week, and that's, for me, seems to work the best without getting any side effects whatsoever.
Yeah, a lot of people need to tinker with the dose to figure out what's working best for your system. Of course, it's best to do that with a doctor that you trust rather than just doing it alone.
I know for a fact that I can take 0.5 milligrams of finasteride, but I don't see a big difference when it comes to how much hair I'm losing taking 0.25 or taking 0.5 milligrams of finasteride.
It's always about balancing efficacy with, of course, the tolerance of the medication.
So I always want to take the lowest dose possible, because that way I get less side effects, and I don't know what this is going to do to myself, let's say in like freaking 10 years or so.
People tend to do very well. Even my patients who've been on this medication for 10, 20 years, they do very well long term, and they really can maintain their hair into much later years. And so some people in their 50s, 60s, even 70s are coming in for just a little bit of hairline work, and they've been on finasteride and they've maintained most of their hair for decades.
But if you actually want to regrow your hair, what I found is that you can utilize Minoxidil. Minoxidil is very common. I utilize it every single night. I take a little bit of Minoxidil.
So as you guys know, I'm a big fan of oral Minoxidil over the topical formulation because, again, of its efficacy. We don't really always think about this, but we give oral finasteride because we know it's quite effective, and yet we're giving topical minoxidil, and we know that's not as effective as oral minoxidil. And why it's given that way has to do with FDA approvals and some of the old studies that were done. But we have plenty of clinical research to suggest that low-dose oral minoxidil is very safe and effective at promoting the increased fullness of your hair. And that's kind of, I think, what he's getting at. And then you can avoid things like, the residue that people feel from topical minoxidil. And just really, it's not as clinically effective to use it as a topical formulation. But again, that's what's FDA approved, and many people will just go with that. But just know that there's another option, which is low-dose oral minoxidil, not FDA approved, and with the right doctors, most people do very well. And that's a great combination that I found in my clinical practice to combine oral minoxidil with oral finasteride. Most of my surgical patients are on that combination and do extremely well.
Rub it into my hair in the areas where I'm currently losing. So currently, for me, it's my temples, as you can see right here. I then use this as a scalp massager. Okay, I rub it in.
Yeah, maybe the scalp massager is increasing the blood flow by a bit. It's probably not going to hurt him, but it's unlikely to be as effective as, let's say, microneedling. And we have an old video on microneedling. And we also have a new video on microneedling for the scalp. So make sure to check those out.
Massage my scalp for 10 minutes, and I do that every single night. One thing you can also utilize as well is microneedling. Okay, microneedling, however, you do not want to get a roller that has 0.5 milligrams. It will have a very hard time penetrating your scalp. So what you need to do is that you need to get that's 1 millimeter, and then what you do, instead of rolling it through your head, what you actually do is that you point it in straight in.
Stamping is what he's getting at. And yes, 1 millimeter might be more effective than 0.5 at increasing your hair growth, but you have to also think about scar potential. And you increase your risk of getting scarring in your scalp as you go deeper into the skin. The actual bulb of the hair follicle lives somewhere around 4 to 6 millimeters within the scalp, from the scalp surface down towards the actual bone. So there is definitely some distance there. If you're going 1 millimeter, you're not going to be at risk of getting to the actual engine of the hair. But you can still cause scar tissue in the actual skin of the scalp. And as we get older and age, our scalp gets thinner. And so what maybe you were able to tolerate in your younger years, as you get older, you might need to get more shallow on the depth of the needles in order to not develop as much scar tissue. Also, there are some risks with doing this stuff at home, and our new video on microneedling gets into some of that risk, and also the fact that in terms of FDA approval, most of these devices that you can buy for home use are not FDA approved for you to be going deeper than 0.3 millimeters. So just keep that in mind.
To actually get thicker hair is to utilize something called gelatin. Okay, gelatin works very, very well. I actually combined it. I found this product back in the day that had both gelatin and saw polymatter. Gelatin will actually make your hair thicker, which is crazy. Really, really good.
Well, that's not really getting at like the root cause of the hair loss or really at promoting the health of the follicle. That's just actually addressing maybe the quality of the actual shaft and making that look thicker. So a little bit of a different mechanism there. And a lot of like shampoos and conditioners will exactly that, get more at the actual shaft health rather than at like the root follicle health. And that's what we tried to do with our Feel Confident line of hair products, which was to try to get at more of the root cause of what's causing the hair loss, like he was talking about here, and also what you can do to regrow your hair, not just what makes the shafts look a little bit shinier or thicker. So there's a distinction there.
But you need to also be aware of things that can make your hair worse. So number one is making sure that you're not smoking or drinking alcohol or consuming processed food.
I mean, there's not like great correlations between, let's say, a drink or two a week and occasional processed food with any significant hair loss, right? So yes, in general, alcohol is not great for you, right? Smoking is not great. Processed food's not great. But to say that if you occasionally have some of this, that will somehow accelerate your hair loss is probably a bit far-fetched.
That you are not showering with water that has a lot of fluoride that really dries out your hair, damage all of the natural oils that you have for your hair. Okay, if you do that, it's going to be very hard. It creates a very unhealthy environment. Your hair is going to be dry, and you will not regrow your hair.
You also don't want your scalp to be too oily because that can also impact negatively on your hair. So you don't want it too dry, you don't want it too oily, you don't want to shower too often, you don't want to shower too infrequently, right? It's always about finding that happy balance.
Things that I found that really works for myself.
And here's a quick sum up of this video. Thank you so much. Bye bye.
Yeah, I've definitely appreciated the categories that Billberg created here and how he was very systematic about his video and his approach overall to optimizing his hair. I think that's been really good. Hopefully I was able to shed some light on some of these various points. And again, thank you, Billberg, for sharing your story.